The diagnosis of periodontal disease and cavities and the evaluation of your bite are important parts of a dental examination. Since you may have no symptoms with periodontal disease, we perform a thorough examination with a periodontal probe and X-rays. With periodontal disease, the bone level falls and the gums pull away from the tooth, forming a pocket. We measure the pocket from the bottom of the pocket, where it's attached to the tooth, to the top of the gums. A probe reading of more than 3 millimeters is a sign of periodontal disease. Bleeding is also a sign of infection. These are healthy gums. They're tight against the teeth. There aren't any pockets, and they don't bleed. Now notice the difference with early periodontal disease. In general, the deeper the pockets, the greater the spread of periodontal disease. In this case of moderate periodontal disease, we see the red and swollen infection of the gums. Look especially close at the difference of the gums between the teeth. This is where periodontal disease usually starts. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are compared with the healthy mouth, and notice the tartar on the teeth. Periodontal disease is caused by the accumulation of plaque. The bacteria in plaque also produce acid. This acid destroys the enamel of your teeth and gives you cavities. Finding cavities is sometimes easy, but sometimes it's not. For hard-to-find cavities, we use a dental explorer and X-rays. We check the tops and sides of your teeth with a dental explorer. To look for cavities between teeth, we use X-rays. Metal fillings and crowns show up as bright white. Cavities show up as dark spots. These small dark spots on this X-ray are cavities. It's far better to catch and restore cavities while they're still small and in the enamel layer of the tooth. Once they're in the softer dentin layer, they really grow quickly. If they make it to the pulp chamber, we have a whole new set of problems and a different treatment to discuss. Root canal therapy. During your checkup, we'll also inspect your bite. A healthy bite allows all your teeth to hit simultaneously and evenly when your jaw joint is seated into its proper position at the base of your skull. In this position, your chewing muscles are also contracting evenly. Bite problems can cause difficulties with your jaw joint, the TMJ. It can also cause bruxism, which is tooth grinding and clenching, and abfraction, the loss of tooth structure that forms notching near the gum line. We want you to know how we diagnose periodontal disease and cavities, and the importance of evaluating your bite, because we believe it's important for you to be an active participant in diagnosis and treatment. We welcome your questions.
In our office, we take pride in adhering to the highest possible infection control standards. We scrub our hands before and after each appointment, and always put on a new pair of disposable gloves. We wear masks and protective eyewear. All instruments are sterilized with an autoclave. Our handpieces are always heat sterilized between patients. We use disposable supplies. We use protective barriers on exposed surfaces and disinfect all other surfaces according to government standards. We dispose of biodental waste and sharp instruments in safe containers provided through a biomedical disposal company. All staff members are vaccinated for hepatitis B. We regularly update infection control procedures for all staff members. We adhere to these infection control procedures because your health and welfare are important to us. The reason for using nitrous oxide, or laughing gas, is for its calming effect. Since it doesn't numb the teeth, anesthetic is still necessary. It just has the nice effect of making a person more relaxed. You breathe nitrous oxide in through a small mask that covers your nose. It takes just a few minutes for you to notice the effects. People most often describe the feeling as being relaxed, unconcerned, happy, slightly numb, and disconnected from what's happening around them. We can adjust the dosage of the nitrous oxide gas to fit your needs. You can also control its effects by your breathing. The more you breathe deeply through your nose, the more you'll feel its effects. There are no long-lasting effects, and you can safely drive after a dental appointment. We won't use nitrous oxide if you're pregnant, have an inner ear infection, or asthma. Let us know if you'd like to try nitrous oxide to feel more relaxed during your next dental appointment. Bite wing x-rays are the most common x-rays taken in dentistry. We use them to find cavities between the teeth, see tartar on the roots, worn out fillings, and receding bone levels from periodontal disease. A small packet of x-ray film is placed inside your mouth, and by biting on the tab on the side of the packet, the film is properly lined up to get a picture of your upper and lower teeth at the same time. The lead apron protects the rest of your body while we take x-rays of your mouth. Dental x-rays use high-speed film, so the amount of radiation exposure is very low. Though machines vary, bite wing x-rays only add as much radiation as you'd get from about 3 extra weeks of natural background radiation. Even if you've recently had x-rays taken of other parts of your body, bite wing x-rays do not add to that exposure. Bite wing x-rays are a necessary part of regular dental checkups. They give us vital information that we can't get from any other source. A full mouth series of x-rays is the first step in a thorough dental examination. We use them to find cavities between the teeth, worn out fillings and crowns, tartar on the roots, and receding bone levels and abscesses. We place 18 separate film packets in specific locations to thoroughly evaluate your entire mouth. The lead apron protects the rest of your body while we take x-rays of your mouth. Dental x-rays use high-speed film, so the amount of radiation exposure is very low. Machines vary, but a full series of x-rays only adds as much radiation as you'd get from about 8 extra weeks of natural background radiation. Even if you've recently had x-rays taken of other parts of your body, a full mouth set of x-rays does not add to that exposure. A full mouth set of x-rays is an important part of a thorough dental examination. It gives us vital information that we can't get from any other source. A panographic x-ray gives us a panoramic view of your mouth. It gives us valuable information about the position of wisdom teeth, receding bone levels, which is a sign of periodontal disease, abscesses, jaw joint problems, and sinus problems. The x-ray film is positioned outside your mouth, and the x-ray head rotates around you. The lead apron protects the rest of your body while we take x-rays of your mouth. Dental x-rays use high-speed film, so the amount of radiation exposure is very low. Though machines vary, a panographic x-ray only adds about as much radiation as you'd get from 10 extra days of natural background radiation. Even if you've recently had x-rays taken of other parts of your body, a panographic x-ray does not add to that exposure. Panographic x-rays are comfortable and safe. They give us information that we can't get from any other source. A rubber dam is a thin protective sheet of rubber that covers your mouth and teeth. It keeps your teeth dry and isolated and allows us to do a better job. To place a rubber dam, we spread it against a special frame and put holes in it that match the teeth we're going to work on. To hold it in place, we secure it to a small clamp that slides over one of your teeth. We use a rubber dam to protect you from swallowing or inhaling liquids, small particles, and vapors that are produced when we're removing old fillings or preparing your tooth for a new filling. A rubber dam also protects your tongue and cheek, and it's perfect for keeping a tooth clean and dry while we restore it. A rubber dam may feel a little strange at first, but it adds another layer of protection for you, lets us work faster and do a better job. Dental insurance can be confusing, and to make matters worse, every insurance carrier handles things differently. Dental insurance plans are a contract between you and an insurance company, in most cases coordinated with your employer. Because our office has no control over this contract, we can't request additional coverage. There are several types of dental insurance: direct reimbursement, preferred provider organizations, capitation, also called dental health maintenance organizations, and indemnity, which are also called usual, customary, and reasonable programs. In direct reimbursement programs, your employer reimburses you directly for part or all your dental treatment. Usually all types of treatment are covered,
and you can see any dentist you choose. In a preferred provider organization program, you must choose from a specific group of dentists that have agreed to discount their fees so that they can be a part of the plan. In a capitation plan, also called a dental health maintenance program, whether you visit the dentist or not, participating dentists are paid, a set amount for each patient enrolled in the plan. The most common insurance programs are indemnity plans, which are also called UCR programs. The initials UCR stand for usual, customary, and reasonable. In these programs, you may find a dentist of your choice, and the dentist is paid on a traditional fee-for-service basis. Monthly premiums are paid to the insurance company by employers, and then the insurance company pays a customary 50 to 80% of their UCR fees, leaving 20 to 50% or more of the total fee to be paid by you. Most people assume insurance companies have gathered statistics and that these statistics are the basis for UCR fees. In most cases, this isn't true. These UCR fees are usually not representative of local dentist fees. They are often fees arbitrarily set by the insurance company. In fact, it's not unusual for the same insurance company to pay different UCR fees to the same dental office, depending on the plan purchased by different employers. Because of this, different insurance companies often have a different UCR for the same geographical area and for the same group of dentists. This also means that the contract that you and your employer have with your insurance company almost always only covers lower quality materials and services, which may not be the best treatment choice for you and your family. That's why it's very common for patients to choose dental treatment that their dental insurance won't fully pay for. Dental insurance just hasn't kept up with the times. The annual limit of dental insurance benefits has hardly budged in 40 years. Back in 1960, a typical annual coverage maximum was $1,000. 40 years later, it still sits at approximately $1,000, despite inflation and cost of living increases. To stay up with inflation, that $1,000 in 1960 would have had to increase to a whopping $5,816 today. And most insurance plans often exclude new treatments they can label as discretionary. Even common treatments such as implants, porcelain veneers, white fillings, bonding, and whitening. In many cases, your insurance company wants you to only consider the cheapest dental procedures, but we believe that you should be able to choose the best, most durable dental treatment and materials for you and your family. Each year, oral cancer strikes approximately 35,000 Americans. Of all the major cancers, oral cancer has the worst 5-year survival rate. Only about 50% of those diagnosed with oral cancer will survive more than 5 years. In fact, oral cancer kills nearly 9,000 people each year. The reason these statistics are so grim is because oral cancer is often detected in its later stages. But when it's detected early, before the disease spreads to destroy healthy tissue, the chances of survival are greatly improved. Because early detection is vital to surviving oral cancer, we will perform a thorough oral cancer screening each time we see you in our office for an exam. We'll feel for lumps or abnormal tissue changes on your neck and inside your mouth. We'll thoroughly examine the soft tissues in your mouth, especially the most frequent oral cancer sites: your tongue, the floor of your mouth, your soft palate, your lips, and your gums. You can also help yourself avoid oral cancer by letting us know if you notice any of these warning signs: a red, white, or otherwise discolored patch or lump in or around your mouth, a sore that does not heal or that bleeds easily, an area that seems to have thickened, raised, or become hardened, a rough patch of tissue, difficulty chewing or swallowing, or a chronic sore throat or hoarseness. And it's vital that you not ignore a mouth sore just because it doesn't hurt. Most precancerous and cancerous lesions are completely painless. You can also minimize your chances of developing oral cancer by making some lifestyle changes. Don't smoke or use chewing tobacco. Avoid excessive alcohol usage. And make sure you're eating plenty of fruits and vegetables each day. One of the most common problems that bring people to our office is sensitive teeth. In fact, about 50 million North Americans suffer with this condition. Sensitive teeth hurt with exposure to cold air, hot or cold food and beverages, or sweets. Often, teeth are sensitive because the dentin layer of the tooth has become exposed. The dentin is the middle layer of the tooth. Above the gums, the dentin layer is normally covered by an outer layer called the enamel, and on the roots, cementum. Dentin contains millions of tiny tubes that extend from the nerves at the center of the tooth to the outer layer. When the dentin is exposed, these tubes are left open. Any stimulation at the surface of the dentin is transmitted through the tubes to the nerves, causing pain. One way the dentin can become exposed is when enamel breaks off the tooth due to a condition called abfraction. This occurs when one tooth hits sooner than the rest. This causes undue stress on the involved teeth, and they begin to flex. Over time, this continual flexing causes the enamel to separate from the dentin layer. Another way the dentin can become exposed is when the enamel is worn away. Brushing too hard using a medium or hard-bristled toothbrush, using an abrasive tartar control or whitening toothpaste, grinding or clenching your teeth, all can expose the dentin. Some dental procedures may temporarily expose the dentin, leading to short-term sensitivity. This condition is called dentin hypersensitivity. Tooth sensitivity can seem merely annoying, but left untreated, the pain can have far-reaching effects. Sometimes it stops people from properly brushing and flossing their teeth. This can lead to more sensitivity, decay, infection, and even tooth and bone loss. To determine the cause of your tooth pain, we'll perform a thorough examination. First, we will make sure that the pain isn't caused by decay, a broken tooth, or abscess. Then we'll continue the exam to find out how the dentin has become exposed. If the problem is abfraction, we may adjust your bite, restore the damage by bonding a filling in place, or crown the tooth. If the problem is a worn-away outer layer, we may remove plaque and bacteria. Present a plan for improved brushing techniques. Treat the area with fluoride, or apply a protective coating or bonding agent. Proper home care is essential to taking care of sensitive teeth. We may recommend that you avoid high-acid and high-sugar foods like tea, citrus, soda pop, and sports drinks. Use a desensitizing toothpaste or mouthwash. Use a soft-bristled toothbrush or electric toothbrush, or wear a night guard if you clench or grind your teeth. HIPAA, or HIPAA, is the Health Insurance, Portability, and Accountability Act. It is a set of standards created by the U.S. Department of Health and Human Services. It was signed into law on August 21st of 1996, with an effective date of April 14th, 2003. The standards were created to streamline the flow of information in the healthcare system and to protect confidential health information from inappropriate access, use, and disclosure. HIPAA regulations apply to any healthcare provider who engages in electronic transactions or transmission of protected healthcare information. Your rights and the privacy of your healthcare information are important to us. Some of your rights under HIPAA that we'd like you to be aware of include confidentiality, access, and the right to copy and amend your protected healthcare information, a right to complain to the Secretary of Health and Human Services, and accounting of certain types of disclosures. As part of our compliance with HIPAA, we will provide you with a notice of privacy practices and ask you to sign a form acknowledging your receipt of the notice. We are always glad to answer any of your questions about our privacy practices or your rights under the Health Insurance, Portability, and Accountability Act.